Okay, begin by showing off all surfaces. And these are my supplies. Okay. My name is Kamisha Harris, and this is my summer 2024 head to toe assessment. Okay, so we will begin by inspecting the patient's skin. This will include head, face, neck, anterior, posterior, chest, along with the abdomen. The skin is warm, dry, and intact. Color is appropriate for ethnicity. No tinting with skin turgor. There seems to be no lesions, no bruises, no nevi, no edema noted. Okay? So we'll go ahead and inspect the patient's head. We see that the head is midline and symmetrical. We're going to inspect the patient's scalp. The patient does have a protective style. There are no lesions. The hair is coarse and black in color. No indentations, no masses, no nodules, and no tenderness noted. Okay, we're going to go ahead and inspect the temporal arteries. No tenderness noted. Okay, once we've inspected the temporal arteries, we're going to go forward and inspect cranial nerve 5, which is the trigeminal nerve. We're going to ask the patient to help us out with assessing the motor skills by clenching the jaws. Clench your jaws. So we're going to assess the masseter muscle. We're also going to assess the TMJ. While we're here, we're assessing for any subluxation, tenderness, or crepitus. Okay, we're going to assess the sensory portion of the trigeminal nerve. So we're going to ask the patient to close their eyes and just let me know when you feel the touch. I feel it. Okay, now we're going to assess cranial nerve 7. So we'll have the patient to open their eyes. This is the facial nerves. We're going to ask you to smile, frown, pucker your lips, puff out your jaws, and raise your eyebrows. Okay? Then we're going to go ahead and inspect the ears. So we're looking at the ears, making sure that they are shaped correctly and that they are symmetrical. Okay, so we're going to palpate the pinnae along with the tragus, looking for any masses or nodules. We'll go ahead and inspect the auditory canal. We're looking for any signs of infection such as redness, swelling. We're going to look at the tympanic membrane, making sure that things are normal. Okay. So after we've assessed the ear, we're going to go ahead and assess cranial nerve 8, which is the vestibulocochlear nerve. So with this, we're going to do a range of 3 tests. So the first test is called the whisper test. So you'll cover one ear, and you'll just repeat after me. 1, 2, 3. Cover the other ear. 1, 2, 3. Okay. Then we'll go ahead and do the Weber test. We'll test for lateralization. The patient should feel the vibration in both ears. Okay. So then we're going to do the Rene test. We're testing for air conduction being greater than bone conduction. So we'll do this to the test to both ears. We're going to place it on the mastoid bone. The patient let us know when there is no longer any vibration. Then we'll place it in front of the ear until she no longer hears the vibration. Each time the air conduction should be greater than the bone conduction. If not, there is an abnormality. Okay, so we have done the 3 tests needed for the auditory. So now we'll go forward to the eyes. We're going to inspect the eyes. So we'll begin by inspecting the eyelashes, the eyebrows, along with the palpable fissure. The eyelashes and eyebrows show no infestations. There are no lesions. Hair is in place, so there seems to be no issues there. The palpable fissure is within normal range. So then we're going to go ahead and inspect the eyes. So we're going to flash the light, pull down just a little on each eye. There's no lesions, no discharge. The pupil is black in color. So then we're going to go ahead and assess for cranial nerve 3, which is the oculomotor nerve. So with this, we're going to use the Snellen chart. We're assessing for visual growth security along with visual growth security along with peripheral and central vision. So we're gonna get about 6 feet away. We're gonna ask the patient to read the lowest line they can read.
ALT, LPH.
Cover one eye.
ALT, LPH.
Cover the other eye.
ALT, LPH.
Okay, and that gives us a 20/20. So now I want you to do the same. Cover one eye. Tell me how many fingers I'm holding up.
1, 2, 3, 1,
Cover the other eye.
2, 3, 4, 1.
Okay, so now we're gonna go ahead and assess cranial nerve 4, which is, no, we're gonna go ahead and assess cranial nerve 3, which is the oculomotor nerve. So now we're assessing for the pupil's reaction to light. So, and we'll also assess for combination and convergence. So I'm just gonna look across at your eye. Okay, cover one eye. Cover the other. Okay, and I want you to focus on the pen and follow. Okay, so then we're going to assess for cranial nerve 3, 4, and 6, which is the oculomotor, abducens, and trochlear. So we're going to have the patient, we're looking for extraocular movements. We're going to have the patient to follow the pen light, so you're focused, keep your head straight, and just follow, okay? Okay. All right, now we're going to check the internal eye structures. So what we're looking for the red light reflex. So we are going to, this is your right eye, so I'm going to, okay. Okay, look at the other. Okay. Red reflex and other internal structures are noted. Okay. So now that we've done with the eyes, we're going to go ahead and go to the nose. So we're looking at the nose. It is intact. It is patent. So we want to go ahead and check for patency. So just extend your head for me. Okay, so now we're going to check for cranial nerve 1, which is the olfactory nerve. So what we'll do is we'll have the patient to close her eyes and occlude one nostril. Okay, so you'll tell me what you smell.
A marker.
Okay, occlude the other nostril. And tell me what you smell.
Vapor.
Okay, so smell is intact and nose is patent. So now we'll go ahead and palpate the sinuses during the frontal as well as the maxillary, noting that there is no swelling or tenderness. Okay, so we're going to inspect the mouth. There are several structures to inspect with the mouth. We're looking at the lips. There's no dryness. They seem to be moist. We're going to ask the patient to smile. So we're inspecting the teeth. The teeth are intact, no spaces. So we're going to say a big eye. We're looking at the tongue, the buccal mucosa, the tonsils, which are intact. Raise your tongue for me. The salivary glands, the soft palate, and uvula. So now we're going to assess, the membranes are pink, moist, and intact. We're going to assess for cranial nerve 9 and 10, which is glossopharyngeal and vagus. So we're going to ask the patient to say ah. Okay. The soft palate and uvula rise with phonation. So we're going to ask the patient to stick out their tongue, move from side to side. Okay, this is assessing, this is inspecting cranial nerve 12, which is the hypoglossal nerve. So the tongue is intact midline without fasciculation. Okay, so we've assessed the mouth. Now we're going to go ahead and inspect the neck. We want to first look for any nodules or masses. So then we're going to palpate. So we're going to first palpate for the trachea that it is midline. So we're going to palpate for the thyroid as well. We'll ask the patient to swallow. Okay, other side. Okay, then we're going to palpate for the carotid artery. So we want to feel that carotid artery pulsation. It is there. And pulse is regular. So then we're going to listen. We want to listen for any bruise. Bruise could indicate an abnormality. So we're going to listen. Okay. So now that we've done the neck, we want to go ahead and inspect the posterior chest. So I have the patient to turn around with the back facing the camera. take care and we're going to inspect. We want to inspect both the posterior and anterior for any signs of respiratory distress, such as retraction, cyanosis, tripod positioning, nasal flaring, anything of that nature. Cyanosis tachypnea, none of it is noted. So we've done our inspection. We want to go ahead and palpate. We'll first palpate for chest expansion. So I'm going to ask my patient to take a deep breath. Okay, chest expansion is symmetrical. Then we're going to go ahead and ask the patient to, whenever you feel my hands, we're going to check for tachyphrenics. You'll say 99, okay?
Okay. 99, 99, 99, 99, 99.
Okay, so we've inspected, and now we're going to percuss over the intercostal spaces. Okay, we've done our percussion. Now we're going to auscultate. So you just breathe in normally for me. The auscultation part will include the lateral lobes. We'll start up towards the scapula. Lung sounds are clear. Now we're going to auscultate for egophony. Each time you feel the touch, you'll say E.
Okay. E, 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 E.
Okay, we're going to auscultate for bronchophy. Each time you feel the stethoscope, you'll say 99.
99, 99, 99, 99, 99, 99, 99, 99.
Okay, now we're going to auscultate for whisper pectoloricoid. Each time you feel the stethoscope, you'll whisper 99.
99, 99, 99.
Okay, sounds are muffled with no signs of consolidation. So now you'll turn around. We've already inspected the anterior chest for any signs of respiratory distress. So now we're going to palpate for chest expansion. We're just going to take a deep breath for me. Okay. And then we're going to do 99 for tachyphrenics, okay?
99, 99, 99, 99.
Okay. So we've done our palpation. Now we're going to percuss over those same intercostal areas. Okay. And then we'll listen, okay? In and out for me. Lung sounds are clear. So now we'll go ahead and auscultate the cardiac auscultation points. With using the bell as well as the diaphragm, we're going to start with the aortic, pulmonic, Erb's point, tricuspid, and the mitral. Okay, we'll do it the other side. Aortic, pulmonic, Erb's point, tricuspid, and mitral. Here's where you will find the point of maximum impulse and the apical heart rate. which we would calculate for 60 seconds. It should give us a rate of 60 through 120 as that being the normal heart rate for adults. Okay, so we've done the cardiac auscultation, so now you can go ahead and lie down. We'll use this to kind of elevate your head. So now we're inspecting for jugular vein distension, so we're going to look at both sides. Okay, so we don't see anything. So I'm going to palpate a little to check. And so we've done our inspection. We look for any heaves and lifts, none noted. So now we're going to listen for any bruise at this area. Then we're going to inspect this area for any thrills. Thrills are small vibrations. So if you feel upon the auscultation points and you feel a thrill, that could indicate a abnormality. So you'll indicate at all points. And after you palpated each point, you want to go ahead and listen again with both the diaphragm and the bell. So we have aortic, pulmonic, herbs, tricuspid, and mitral. We'll listen again. Pulmonic, tricuspid, herbs point, tricuspid, and then mitral. Okay? So after we listen to our cardiac, we want to go ahead and inspect the abdomen. So we're looking at the abdomen. We want to look at the contour. It is rounded. Everything is symmetrical. Then we want to go ahead and listen. We want to listen to the arteries of the stomach. So we'll start at the aorta. Then we'll do the renal, the iliac, and the femoral, which is a little bit lower on the legs. Now we'll listen to the bowel sounds in all 4 quadrants. So once you hear the bowel sounds, you can listen for about 2 to 3 minutes in each quadrant. If you don't hear them, you want to listen a little bit longer, about 5 or 10 minutes, as we don't want to miss any blockages. Okay, bowel sounds are normal. So we've inspected. Now we're going to palpate for any, we're going to percuss. So we're percussing for tenderness, we're percussing for tympany, dullness, or fullness. Tympany may mean that it's air-filled. Dullness could mean that it's fluid-filled or over a solid organ. So now we're going to palpate. We are palpating for any tenderness or masses. Okay? None noted. Now that we're done palpating, we're going to go ahead and palpate for your spleen since we're on this side. Okay? Then we're going to come on this side, the right, and palpate for that liver. Okay? Then you'll sit up and turn to the back. We're going to assess you for CVA. So we're just going to kind of grab here. We're looking for any pain with the kidneys. Okay. You turn around. We're going to go back and assess our head and neck lymph nodes with the preauricular, postauricular, occipital, tonsillar, submandibular, submental, anterior cervical, exterior cervical, and supraclavicular. Okay? So now we can go ahead and inspect our hands. So we're going to inspect our upper extremities, hands, wrists, elbows, and shoulders. No nodules, no crepitus, no warmth or redness, no edema noted. So then we're just going to palpate. We're going to go ahead and check the capillary refill on both. And then we're going to go ahead and check those radial pulses, which are present. Okay, then we'll do our range of motion. So we're going to flex extend, hyperextend, abduction, adduction, thumb opposition. We're gonna do our wrist, we're gonna flex, extend, hyperextend, internal rotation or eversion, inversion and eversion or external rotation. Okay, then we're gonna do rotation. So we're gonna do our elbows straight down, then we're gonna come up and flex, extend, hyperextend. Okay, then we'll do our shoulders. We're gonna flex, extend, hyperextend. Then we can do internal rotation, external rotation, rotational circumduction, abduction, adduction. Okay? So now we're going to assess for our strength in our hands. We're going to assess strength, so I want you to grab my hands. Okay? Then we're going to assess for strength in your biceps or triceps. So this is when you have to pull them up for me and you're fighting against resistance. So drop your arms, then bring them up. Okay? Keep them up, then bring them back. Okay? We're going to do the same with our shoulders. So you want to bring them up. Okay? And then bring them down. Bring them down. Okay? So we assess for strength. Now we're going to, if you want to have a seat, we're going to do stereoopnosis and graphesthesia. So close your eyes. I'm going to write something in your hand. You tell me what it is. I'll place something in your hand. You tell me what it is.
A cotton ball. A marker.
Okay, keep your eyes closed. We're gonna go ahead and check for light sensation. You tell me when you feel the touch.
Feel it. 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 Feel it.
Okay. Then we're gonna go ahead and assess for vibratory sensation. So hold your wrist out. You should feel the vibration when I touch it.
I feel it. I feel it.
Go ahead and put your feet down. Go ahead and tap back here as well.
I feel it. I feel it.
Okay. So we've done that. We've assessed. We're gonna do your cerebral motions. So we're gonna do stereo opposition first, touching each finger to the next. Then you're gonna do hand flop. Then we'll do finger to finger. Okay. Then we're gonna do our deep tendon reflexes with our hammer. So we'll start to break your radialis. So just place your hands down. Okay, with your brachioradialis. You feel that, see that flexion. Okay. Then we're gonna do our biceps. So you rest your arm. I'm gonna move them. Okay. Okay. And then we'll go ahead and do the tricep on this side. Okay. So we've done that. And now we'll go ahead and do the knee as well. Rest your leg. Okay. Then we'll do the Achilles. So I'm gonna hold this foot up. Okay. Okay. Then we're gonna do the Bambinski. So hold your foot up for me. Okay. Okay. So then we're gonna inspect your lower extremities. Same thing with your lower extremities. No swelling, no redness, no discoloration or anything. So we're gonna do the rotation of your toes. So you're gonna flex, extend, hyperextend. And you do it with your other foot. You can sit down and do it if you want. So with your other foot, you're gonna flex, extend, hyperextend, spread both your toes. Abduction, put them together. Abduction, internal rotation, external rotation, rotation. So with your ankles, you're going to plantar flex, dorsiflex, inversion, eversion, rotation. Okay, you understand? We're gonna do our knee. We're going to flex, extend, hyperextend, legs, extend, hyperextend. Okay, we can go ahead and do our hip while we're up. So we're going to flex, extend, hyperextend, abduction, internal rotation, external rotation, and rotation. You do the same with the other one. Extend, hyperextend, abduct, adduct, internal, external, then rotate. Okay, so after we've done that, we're gonna go ahead and check your capillary refill in your toes. Okay. We're gonna also check your pulse at your dorsal pedis and your tibial. Okay. All right, so we've done that. We're gonna go against resistance. So you'll feel me push down on the ankle and you bring it up. Okay. Same with the back, you bring it back. Okay. Okay, same with your knee. Okay, stand, we'll do the same with your hip. You're gonna flex it. Okay. Extend it. Okay. Flex it. Extend it. Okay. So we've done our feet, we've done our hips. So now I'm going to examine your back. Oh, wait. Yeah, I'm gonna examine your back. So we're looking at the back, looking for any scoliosis, any curvature. Everything seems symmetrical, no issues. So now we're going to go ahead and do our range of motion for our lumbar spine, which is our back. So we're gonna flex, extend, hyperextend, lateral rotation, lateral rotation, and then rotation. We'll do the same with our cervical spine. We'll flex, extend, hyperextend, lateral rotation, and then rotation. Okay? Next, I want you to stand still, close your eyes. This is a lumbar test. Negative will be you swing, you're not swinging, so that's a good thing. Open your eyes, and we're gonna assess your gait. You're gonna take us a couple steps forward, take a couple steps backwards. Okay, then you'll hop on one foot, do the other one. Okay, and this concludes my summer 2024 head to toe exam.